All right, so listen to this. Today we're going to be diving into a topic that I honestly didn't know much about before we started researching it, osteomyelitis.
Interesting.
We're talking bone infections, folks, and how diabetes plays a surprisingly big role.
Wow.
Our main source material for this deep dive is an article called Osteomyelitis and Diabetes, What You Need to Know to Keep Your Bones Safe. Anyone with diabetes, or honestly anyone who wants to learn more about this often overlooked risk, should listen closely.
It's interesting. We often think about diabetes and blood sugar and how it relates to things like the kidneys or the eyes.
Right.
But bone health is just as crucial.
I'll admit, before reading this article, I never really made that connection.
Yeah.
So break it down for me. What exactly is osteomyelitis?
Well, osteomyelitis is an infection that settles in the bone.
Okay.
What makes it particularly concerning is that bone is incredibly strong.
Right.
They found human bone fragments that are thousands of years old.
Wow.
So for something to infect bone, it has to be
Ugh.
pretty powerful, right?
Yeah, you're right. I never thought of it like that. So what kind of powerful force are we talking about here? What causes these infections?
The most common culprit is a bacteria called Staphylococcus aureus.
Oh, okay.
It's the same bacteria that can cause skin infections.
Okay.
But osteomyelitis can also be caused by other bacteria or even fungi.
And the article mentions that if it's not treated, things can get pretty bad.
Yes, untreated osteomyelitis can lead to inflammation, pain, and even the death of bone tissue, which is called necrosis.
Wow.
In some cases, it can even lead to amputation.
Amputation. That's serious.
It is, and the source material emphasizes that this is especially concerning for people with diabetes. Their
Right.
feet and toes are particularly vulnerable.
So how does this infection even get started? How do these bacteria or fungi actually reach the bone?
There are a few ways it can happen.
Okay.
Imagine an infection spreading like wildfire.
Okay.
Sometimes it starts in nearby tissue, like a diabetic foot ulcer. That's called contiguous spread.
So it's almost like it creeps in. Oh, okay.
Then there's direct inoculation,
Uh-huh.
where the bacteria enter directly through a wound.
Okay.
Think about stepping on something sharp.
Ouch. That makes me think I should make sure my tetanus shot is up to date.
Right.
Is there another way this can happen?
The third way is through hematogenous spread, which means the infection travels through the bloodstream.
Okay.
This is more common in people with weakened immune systems.
Okay, so we've got a few ways this infection can happen, and we know it can be pretty serious, but why is there this link between diabetes and osteomyelitis? What makes people with diabetes more vulnerable?
There are actually a few reasons for that.
Okay.
One of the biggest is peripheral neuropathy.
Okay.
This is nerve damage that often affects the feet in people with diabetes.
Right.
Because of this nerve damage, people with diabetes may not feel pain in their feet as readily.
So they might not even realize they have a cut or an ulcer that's getting infected.
Exactly.
Wow.
Then you add in poor circulation.
Yeah.
Another problem that's common with diabetes.
Right?
This means wounds heal more slowly, and it's harder for the body to fight infection.
So these two factors together, neuropathy and poor circulation, really create a difficult situation.
Yeah.
Are there other factors that play a role here?
Yes. There's also the fact that high blood sugar can weaken the immune system.
Okay.
It's almost like having a security system that isn't working properly. It makes it harder for the body to defend itself against infection.
Okay.
And finally, foot ulcers, which are common in people with diabetes, can act as entry points for bacteria to get to the bone.
Wow. It really does sound like a perfect storm of factors working against people with diabetes when it comes to this type of infection.
It is.
That's why recognizing the signs and symptoms early on is so important.
right.
All right, let's talk about the signs. What should people be looking out for?
Well, the telltale signs are fever and chills, even if they're mild.
Okay.
Also, any swelling, warmth, or redness around a wound.
So it's those classic signs of infection, but in this case, it could mean something more is going on.
You got it. Another sign is bone pain, particularly if there's a wound nearby.
Right.
But remember, neuropathy can mask the pain, so even mild discomfort shouldn't be ignored.
Right. That neuropathy can really complicate things.
Yeah.
What about the wounds themselves? Are there any signs there that could point to osteomyelitis?
If you have a chronic wound or ulcer that simply won't heal, that's a big red flag.
Okay.
Also, any drainage or pus from a wound is a clear sign of infection.
So we're talking chills, fever, swelling, redness, pain, non-healing wounds, and drainage.
Right.
If you're experiencing any of these, especially if you have diabetes, it sounds like you need to get medical help immediately.
I couldn't agree more. Early intervention is crucial.
Let's say you do have some of these symptoms. How do doctors actually diagnose osteomyelitis? I mean, bones are on the inside, right? How do they even know what's going on in there?
It does take some detective work.
Yeah.
The first step is a physical exam where the doctor will look for those outward signs we just discussed.
So the doctor is starting with those visual clues, but what if those aren't clear?
Then they'll likely order some imaging tests.
Okay.
X-rays can be helpful, but sometimes they don't show much in the early stages of the infection.
So they need something more powerful.
Exactly. An MRI or CT scan can provide a much more detailed look and can detect infection even in the early stages.
Those are the heavy hitters when it comes to imaging. But is there a way to be absolutely sure it's osteomyelitis?
The gold standard for diagnosis is a bone biopsy.
So they go straight to the source. What does a bone biopsy entail?
In a bone biopsy, a small sample of bone is taken and then tested for the presence of bacteria or fungi.
Okay.
It's the most definitive way to confirm the diagnosis.
So it's really a multi-pronged approach, the physical exam, the imaging, and potentially a bone biopsy. And of course, blood tests can help too, right?
Right? Blood tests can be very helpful because they can show signs of infection like elevated white blood cells.
So we've talked about how the infection happens, how to spot it, and how it's diagnosed. Now, let's get into treatment.
Oh.
What are the options for fighting osteomyelitis?
Antibiotics are the first line of defense.
Okay.
The article emphasizes that these are usually given intravenously at first.
Intravenously. That sounds serious.
It is.
Yeah.
This helps get the antibiotics into the bloodstream as quickly as possible to begin fighting the infection.
Okay.
And depending on how severe the infection is, you might need to be on antibiotics for weeks or even months.
Wow, that's a long time. Is surgery ever necessary?
In some cases, yes.
Okay.
If the infection is severe, surgery might be needed to remove infected bone or tissue.
So they have to go in and literally cut out the infected part.
Okay.
What about wound care? We talked about those diabetic foot ulcers being a starting point for a lot of these infections.
Right.
What role does wound care play in the treatment process?
Wound care is extremely important, especially for those ulcers.
Right.
The source material talks about debridement,
Okay.
which is the removal of dead tissue from the wound.
So they're cleaning out the wound and getting rid of anything that could help the infection grow.
Exactly. And then they use special dressings to help the wound heal properly.
Okay.
Sometimes they'll even use hyperbaric oxygen therapy.
Hyperbaric oxygen therapy, what's that?
It's a treatment where you breathe pure oxygen in a pressurized chamber.
Oh, wow.
It helps wounds heal faster by increasing the amount of oxygen that gets to the tissues.
That's fascinating. It sounds like a pretty intense process.
It can be, and unfortunately, in the most extreme cases, when the infection is really advanced or it just can't be controlled with other methods, amputation might be the only option.
That's a tough thought. It really drives home how important early diagnosis and treatment are.
Absolutely.
Yeah.
But here's the good news.
Yeah.
The article spends a lot of time talking about prevention.
Okay. Prevention is always a good thing. So what are some key takeaways for our listeners who want to protect themselves from osteomyelitis, especially if they have diabetes?
The most important thing is blood sugar control. Keeping your blood sugar within a healthy range goes a long way in preventing all sorts of complications from diabetes, including those that increase the risk of osteomyelitis.
So managing diabetes is essential not just for organ health, but for bone health too.
That's right. The article also stresses the importance of daily foot inspection, especially for people with diabetes.
What exactly should you be looking for when you're doing those foot inspections?
Look for anything out of the ordinary.
Okay.
Cuts, blisters, sores, redness, anything that's unusual.
And don't forget to check between your toes.
Absolutely. It's easy to miss things there.
Right.
Along with daily inspection, keeping your feet clean and dry is crucial.
Okay.
Wash them every day with mild soap and make sure you dry them thoroughly, especially between the toes.
Good hygiene is a must. What about footwear? What should people with diabetes keep in mind when it comes to shoes and socks?
Always wear protective, well-fitting shoes and socks.
Okay.
And avoid going barefoot even inside your house to minimize the risk of injury.
That's a good reminder. Even a tiny cut can become a big problem if it gets infected.
And if you do happen to develop a foot ulcer, don't wait to get medical help.
Right.
Early treatment is key to preventing it from worsening
Right.
and potentially leading to osteomyelitis.
Be proactive, not reactive. That's a great motto.
Yeah.
The article also mentions something that applies to everyone, not just people with diabetes.
Yes, quitting smoking.
Of course, quitting smoking, it's good for so many things. What makes it important when it comes to osteomyelitis?
Smoking impairs blood circulation, which we know is a major risk factor for ulcers and infections.
So ditching the cigarettes is good for your heart, your lungs, and your bones.
Exactly.
We've covered a lot of ground here. Just to recap, osteomyelitis is a serious bone infection that can have some really tough consequences, particularly for people with diabetes.
But the key takeaway here is that it's often preventable.
Right.
Managing your diabetes well, taking good care of your feet, and getting medical help quickly if any problems arise can make a huge difference.
Absolutely, knowledge is power, and in this case, it could literally help save your limbs.
I couldn't agree more.
Before we wrap up this part of our deep dive, let's take a quick pause.
Okay.
When we come back, we'll explore some more details about osteomyelitis. Stay tuned.
Sounds good.
Okay, so we're back and ready to continue talking about osteomyelitis. You know, before we started this deep dive, I really had no idea how common and how serious this infection can be.
It's true. Osteomyelitis often gets kind of overshadowed by other diabetes complications.
Right,
It's really important, though, to understand how diabetes impacts bone health.
right. And we talked about how high blood sugar can weaken the immune system,
Mhm.
but the article really dives into how diabetes impacts circulation,
Oh, yeah.
which is a big part of this whole puzzle.
Absolutely. It's like this domino effect.
Yeah,
High blood sugar damages the blood vessels, which leads to poor circulation,
right.
especially in the feet.
Okay.
And when blood flow is sluggish, it's harder for the body to fight infection and heal properly.
So it's like the body's defenses are delayed in getting to the battlefield.
Exactly. Think of it like this.
Oh, wow.
White blood cells, nutrients, and oxygen are like the troops, the supplies, and the fuel needed to fight an infection.
Right.
But if the roads are blocked because of poor circulation, those vital resources can't get to where they're needed fast enough.
That's a great analogy. It helps me understand why even small wounds can become such a big problem for people with diabetes.
And those wounds can become breeding grounds for bacteria.
Right.
If they're not treated promptly, those bacteria can burrow down and reach the bone,
Ugh.
leading to osteomyelitis.
Yeah, that's a pretty unsettling thought.
It is. And remember, because of neuropathy, people with diabetes may not feel the pain of these wounds as intensely.
Right.
This can lead to delays in treatment, giving the infection more time to take hold.
It really does sound like a perfect storm of factors that make people with diabetes so vulnerable.
It is.
This source really emphasizes prevention and early detection.
It definitely does. And here's another point I want to highlight from the article.
Okay.
Even after an osteomyelitis infection is treated,
Uh-huh.
there's a chance it can come back.
Oh, no, really? I was thinking of it like a one and done kind of thing.
Yeah.
But it's not that simple.
Unfortunately, no.
Oh, wow.
Osteomyelitis can recur, especially the underlying conditions that contributed to it in the first place aren't well managed.
That makes sense. So it's not just about treating the infection, it's about addressing those underlying risk factors as well.
Exactly.
Mm.
That's why long-term follow-up care is so important.
Okay, so vigilance is key even after treatment.
Mm-hmm.
What can people do to minimize that risk of the infection coming back?
It all comes back to those prevention strategies we talked about earlier. Keeping blood sugar under control, practicing meticulous foot care, and seeking prompt medical attention for any wounds or sores.
Right.
These aren't just one-time measures. They need to become lifelong habits.
So it's really about empowering people with the knowledge and tools to be proactive about their health.
You got it.
Yeah.
And that's where healthcare providers play a crucial role.
Yeah.
The article mentions that doctors need to do a better job of educating their patients with diabetes
Right.
about the risk of osteomyelitis. It shouldn't just be about blood sugar control.
Right.
It needs to be a comprehensive approach that includes bone health.
So it's a two-way street. Patients need to be informed and take ownership of their health. And doctors need to make sure osteomyelitis is on everyone's radar.
I agree. Early diagnosis and treatment are essential for better outcomes.
Right.
And for people with diabetes, regular foot exams by a podiatrist are incredibly important.
It's like having a foot expert on your side.
Exactly. A podiatrist can often spot subtle signs of problems that someone might miss on their own.
Yeah.
That early intervention can prevent a minor issue from turning into something much more serious.
This article is really packed with valuable information. I'm already thinking about how I can apply this knowledge to my own life, even though I don't have diabetes. It's a good reminder to be more mindful of my foot care and to seek medical attention promptly for any wounds that aren't healing properly.
I think that's a great takeaway for everyone.
Yeah,
We often take our feet for granted,
we do.
but they literally carry us through life. And for people with diabetes, that extra care and attention can be truly life-changing.
It really can. We've covered so much ground in this deep dive. I feel like I've learned a ton about osteomyelitis and its link to diabetes.
Me too. It's a topic that definitely deserves more attention. Hopefully, this discussion will empower our listeners to take steps to protect their bone health.
I think it will. And before we wrap up this part of the discussion, let's take a moment to reflect.
Okay.
When we return, we'll share some final thoughts and key takeaways for you to consider.
Okay. And we're back for the final part of our deep dive into osteomyelitis.
Oh.
We've been talking about this condition using the article called Osteomyelitis and Diabetes, What You Need to Know to Keep Your Bones Safe.
Yeah, it's been quite a journey, hasn't it? We've uncovered the dangers of this bone infection.
Explored its connection to diabetes and really emphasized the importance of prevention.
It's remarkable how something as seemingly minor as a foot ulcer can turn into such a serious problem.
It really is. It highlights how interconnected our health is.
Yeah.
This source really underscores the importance of a holistic approach to health,
Right.
especially for those managing diabetes.
Yeah, it's not just about keeping tabs on your blood sugar.
Right.
It's about recognizing how diabetes can affect pretty much every part of your body, including your bones.
Exactly. And that's what makes this deep dive so important.
Right.
It's shedding light on a risk that many people, even those living with diabetes,
Yeah.
might not be fully aware of.
I know I wasn't, but now I am. And now equipped with this knowledge,
Right.
we can all be more proactive about protecting our bone health.
Knowledge is power.
Yeah.
That's what we're all about here.
Yeah.
Before we wrap up, I want to leave you with a thought-provoking question.
Hit me with it.
Thinking about everything we've discussed about osteomyelitis,
Mhm.
its causes and the ways to prevent it, what's one step you can take today to prioritize your bone health, especially if you have diabetes?
That's a great question and a great call to action.
Yeah.
It reminds us that we're not just passive listeners here.
Right.
We have the power to make choices that impact our well-being.
Exactly.
Sure.
Whether it's committing to better blood sugar management, being more diligent about foot care, or even just starting a conversation with your doctor about this risk.
Right.
Taking action is key. Remember, even small steps can make a big difference.
And it's never too late to start prioritizing your health.
Right.
Every single day is a fresh start,
Mm.
a chance to make positive changes.
I couldn't agree more.
Yeah.
So that concludes our deep dive into osteomyelitis. Hopefully the insights you've gained will stay with you long after this episode ends.
Absolutely. We've explored the severity of this condition, but we've also highlighted the importance of prevention and early detection. Remember, knowledge is power. And when it comes to your health, being informed is the first step towards a healthier, happier you.
So go out there armed with this knowledge and take charge of your bone health. Until next time, keep those brains curious and those bodies well cared for.
That's a wrap, everyone. We'll catch you on our next deep dive into another fascinating topic. Until then, stay curious.